Thank you, Steph. And as we mentioned, hundreds of replacement workers have been brought in to cover for those striking nurses at Rhode Island and Hasbro Children's Hospitals.
New live at 5, the Department of Health's director explains the process of getting these temporary employees up to speed. Eyewitness News reporter Susan Campbell joins us now live in studio with more in-depth coverage. Susan?
Mike and Shannon, Lifespan didn't give us an exact number, but a spokesperson says hundreds of temporary workers from all over the country were brought in to cover shifts at Rhode Island and Hasbro Children's Hospitals. Busloads of temporary workers arriving at the hospital.
We have evaluated and seen that the nurses that are brought in are experienced nurses.
Dr. Nicole Alexander Scott is the director of the Rhode Island Department of Health. She says the agency fast-tracked licenses for out-of-state nurses.
There were a few that were not accepted. We went through the appropriate process to make sure that those that were issued license fulfilled the same high-level standards that are required for anyone that's issued a license in Rhode Island.
The temporary employees were brought in by Huffmaster, a company based in Michigan that says it specializes in strike management.
Rhode Island Hospital has been working with them for several months since the end of last year to gear up for replacement workers. There's been a significant amount of training that's been done for the nurses that have been brought in to help make sure that they understand the flow of activities at the hospital, where things are located, how to communicate information. And that's the type of assessment we'll be making when we go to the hospital.
But striking workers say they have real concerns about patient safety.
It was sad walking out, I'm not going to lie. I was on today and I just came out. They had us leave earlier than 3, and it was hard. It's sad. It's really sad, but we got to do what we have to do.
Huffmaster did not respond to my request for an interview. Coming up new at 6, how much the temporary nurses are being paid. I'm Susan Campbell, Eyewitness News.
Thank you, Steph. Meantime, Lifespan bringing in replacement workers to fill shifts during this strike.
And we wanted to know how much they're being paid. Eyewitness News reporter Susan Campbell continues our in-depth coverage now live in studio. Susan?
Mike and Shannon, we found the job postings online. For a couple examples, registered nurses are being offered $60 an hour, licensed practical nurses $38 an hour. All of the temporary workers on site have been licensed in Rhode Island. As nurses and other union workers picketed, temporary workers arrived at the hospitals to fill in.
We did our part in making sure that people were licensed, but there have needed to be adjustments made with the company to help make sure that the staffers are trained and ready to go.
The temporary workers were brought in by Huffmaster, a Michigan-based company that contracted with Lifespan to deal with a strike. We found dozens of job postings on Huffmaster's website. For example, for RNs, the rate for temporary employment in Rhode Island is $60 an hour. The jobs also cover travel expenses and meals. The director of the Rhode Island Department of Health says all of the temporary workers will be closely monitored.
There are nurse managers that are continuing in their management role in overseeing the nurses that come into play. And as we're going forward, we will continue to have this very close monitoring and engagement with staff from the Rhode Island Department of Health at the hospital sites through the shifts to help ensure that the transition of care will be and maintained at the level of quality that we all expect.
According to the job posting, temporary nurses are guaranteed at least 60 hours of pay once they're deployed. I'm Susan Campbell, Eyewitness News.